This AI can predict your health in 10 years. Would you want to know if you develop Alzheimer's in 15 years? What about heart disease or cancer? These questions aren't hypothetical anymore. They are becoming real choices as AI prediction transforms medicine. In the next few minutes, I'll show you exactly how these algorithms work, the ethical dilemmas they create, and why some doctors are embracing this technology while others are pushing back. The future of preventive healthcare is being rewritten right now. Did you know that an algorithm can predict your risk of pancreatic cancer up to 3 years before a doctor can spot it on a scan? That's not science fiction. It's happening right now. When I first read about this, I was floored. We're talking about pancreatic cancer, one of the deadliest forms because it's usually caught too late. But now, AI is changing that timeline completely. Let me break down what's happening behind the scenes. Today's medical AI systems are like digital detectives, sifting through millions of data points from your medical records, genetic information, and even routine blood tests. They're spotting disease patterns long before any symptoms show up. Think about that for a second. These algorithms are essentially predicting your health future. Your doctor probably sees you once a year, right? During that visit, they might review a handful of test results and ask about any new symptoms. But there's only so much a human brain can process. Even the most brilliant physicians are limited by time constraints and cognitive capacity. Meanwhile, these AI systems are connecting dots across your entire medical history, finding patterns that human doctors simply can't process on their own. The numbers really tell the story here. Take Google Health's AI system that are reading mammograms. They are outperforming trained radiologists with 9.7% fewer false negatives and 5.7 fewer false positives. That translates to fewer missed cancers and fewer unnecessary biopsies and anxiety for patients. Real women are getting more accurate results because an algorithm caught something a human eye missed. What makes this possible goes way beyond raw computing power. It's about how these systems learn. They're studying millions of patient outcomes, looking at what happened to real people over time. When an AI analyzes your medical data, it's comparing your patterns against this massive knowledge base, identifying subtle signals that even experienced doctors might miss without technological assistance. Heart disease is another area where AI is proving its worth. The most advanced predictive models can now forecast heart attack risks with 80 to 90% accuracy by analyzing standard EKG readings that would look completely normal to most cardiologists. Imagine going in for a routine checkup and having an algorithm potentially save your life by spotting a heart attack risk months or years before it happens. Alzheimer's detection is also being revolutionized. AI can spot tiny changes in brain scans and speech patterns up to 6 years before clinical symptoms appear. 6 years. That's half a decade of precious time for interventions, lifestyle changes, and planning. For families affected by Alzheimer's, those extra years of awareness could make all the difference in quality of life and care planning. The impact on cancer detection overall is staggering. AI can detect various cancers an average of 4 to 5 years earlier than traditional diagnostic methods. Think about what that means in real terms. It's potentially turning deadly late-stage diagnosis into treatable early-stage interventions. That's not just extending lives, it's saving them completely. Let me be clear, this isn't about replacing doctors at all. No algorithm can replace the human connection, the experience, the knowledge, and the judgment that good physicians bring to healthcare. What AI offers is more like a superpower for these medical professionals, giving them wings and awesome ability to see what's happening in your body long before traditional medicine could spot it. Imagine your doctor having access to an AI assistant that has already reviewed your entire medical history, spotted concerning patterns, and flagged potential issues before your appointment even begins. That doctor can now use their training and expertise more effectively, focusing on the areas that truly need attention, rather than hunting for needles in haystack. I think about how this could have changed things for so many people I know who received diagnosis too late. A relative of mine was diagnosed with stage 4 lung cancer that had already spread throughout their body. The doctors told us it had been probably growing for years. What if an algorithm had spotted something unusual in his routine blood work 3 years earlier? That's the promise here, not replacing human care but enhancing it dramatically. So where does all this lead us? We're witnessing a fundamental shift in medicine, from waiting for symptoms to preventing them entirely. This AI revolution isn't just changing diagnosis timelines, it's redefining our relationship with our own health data. Think about it. Every day, these systems grow smarter, processing millions more data points, recognizing patterns that were previously invisible. The technology that saved Sarah continues evolving exponentially. The real question we face isn't if AI will transform healthcare. That's already happening. It's how quickly society, medical systems, and we as individuals will adapt to a reality where algorithms might understand our biological futures better than we do. That's all I've got for you today. I'll see you in the next video.